Hi classmates, my name is Jessica and this would be my responses for blog number 3 of our Leadership and Nursing in Management class. Question 1. What skills described in Chapter 7 and Leadership Skills Questionnaire would you use to secure needed resources? After completing the Leadership Skills Questionnaire, I learned that my leadership skills were evenly distributed across all 3 broad types of leaderships: administrative, interpersonal, and conceptual. I scored in the high range in all 3 categories, meaning I have a nice balance between task-oriented and relationship-oriented behavior. This leads me to believe that I am focused on getting work done, but also attuned in the general well-being of my team members. Some of the skills described in Chapter 7 that I would use to secure needed resources as a leader are planning, organizing, directing, and coordinating. I feel planning is a crucial and continuous process, and it lays the foundation. Planning begins with setting goals and objectives and then laying out a plan of action to accomplish them. Organizing is just as important. It is the process of engaging your coworkers and identifying and grouping the work to be performed and defining and delegating responsibility and authority. Directing and coordinating, I feel, go hand in hand. It involves determining the course and guiding and overseeing coworkers so that they can contribute efficiently and effectively to attainment of the goal. I, as a leader, have concurred with multiple attributes of excellence illustrated by Peter and Waterman on page 150 in our Leadership and Management textbook. The first one I agree with is number 1, a bias of action. It states managers are visible and close to a work unit. The managers are ready and willing to become involved. The second one I agree with is number 4, productivity through people. It concerns the emphasis of respect for individuals in the workplace. It fosters enthusiasm, trust, and a family feeling. The third I agree with is number 5, hands-on, value-driven. It states leaders are positive role models and not rigid authoritative managers. And the last I agree with is number 6, stick to the knitting. Its emphasis is on the internal growth of the company. Question 2. How would you use published literature in the process? I chose the article Transdisciplinary Care in the Emergency Department, a Qualitative Analysis, which was published in the Internal Emergency Medicine Journal in November of 2016 because it relates currently to my specialty area of nursing. The article starts by clarifying care models: transdisciplinary, multidisciplinary, and interdisciplinary. For me, I would have guessed they were all the same until I read the article. Transdisciplinary teams cross the boundaries of specialties by means of members of the team sharing knowledge, skills, and responsibilities by completing training in other fields and thereby increasing each team member's scope of practice and flexibility in the workload. So the article showed a transdisciplinary team was a very valuable resource in the emergency department. It also showed that it facilitated the discharge of many patients who would otherwise have been admitted to the hospital. As a manager of an emergency department, I think I would use and utilize a transdisciplinary care model because it has the potential to provide quality and more effective patient-centered care. It increases the throughput of patients and improves staff satisfaction. Question 3. Identify levels and departments you would need to work with in order to be effective in your role. So the level and departments that I would need to work with in order to be an effective manager of an emergency department would be the admitting teams, also known as hospitalists. So partnering effectively facilitates timely admissions and ultimately reduces the capacity of the ER department. I'd also have to be effectively engaged with inpatient leaders from the critical care unit, the telemetry unit, and med-surg unit. So proactive communication and means of bed huddles are imperative. We collect information regarding census and staffing ratios to improve patient flow. I feel that inpatient leader rounding in the ED with our borderers ensures both patient safety, quality, and trust. And then the no delay nurse reports or fax reports are an important tool to reduce time from admit order to arrival to unit because it decreases handoff errors and increases patient perception of care. I would have to have an effective relationship with the transport leader. This would help facilitate patient transport to diagnostic testing and admitted patients to the floor. I'd have to have an effective relationship with the environmental service leader because it helps facilitate turnover of dirty beds, both inpatient and ED. I'd have to have an effective relationship with the radiology leader, which would ensure that ED patients take priority over everything else in order to help facilitate throughput of the emergency department. I'd have to have an effective relationship with the staffing office, which would help fill vacancies and call-outs that ensure the staffing grid is appropriate, that the correct nurse-to-patient ratio is safe. I'd have to have an effective relationship with case management. Case management helps a lot when it helps reduce ED frequent users, which contribute significantly to ED overcrowding and extended waits. Question 4. Explain if you feel you would prefer a vertical or horizontal structure and why. I think I prefer a horizontal structure because it's an employee-centered approach. It empowers employees, increases satisfaction, gives them greater freedom and autonomy. It streamlines communication and leads high levels of cooperation throughout the organization. It makes the organization more adaptable to change.